Thank you for joining us for this webinar on GIS and COVID-19. We will be looking at how mapping supports the response and recovery efforts of this pandemic. My name is Carmel Terborg, and I'm the lead account manager on the Esri nonprofit and global organizations team at Esri. And in that role, I'm responsible for supporting the World Health Organization, as well as other UN system entities. I'm joined today by my colleague Calvin Kwan, who is a solution engineer on the same team. Calvin will be giving the majority of the presentation today as he shares with you the workflows that ArcGIS Pro can support for the response and recovery phases of this health emergency in our communities. Our team supports nonprofits, NGOs, and international organizations around the globe that work to create sustainable development in a more humanitarian world. We are thankful that so many of you have taken the time today to join us to learn more about this topic and hope that you will gain skills and ideas to apply in your work. Before we start, a little housekeeping. If you have any questions during the presentations, please type them into the question box in your GoToWebinar control panel. We will be monitoring the questions during the presentation, and we will have time for questions and answers at the end. At the beginning of today's agenda, Calvin will not only introduce you to the basics of ArcGIS Pro, but get you started on workflows central to COVID-19 response and recovery. These workflows include understanding your community, assessing COVID-19 risks in a community, modeling diseases spread, and allocating resources. In exploring these workflows, he will leverage data from governments, Esri's Living Atlas, and other data providers. Following the presentation by Calvin, we will introduce you to two members of the user community that have been using ArcGIS in their COVID-19 related work during the last few months. First, Patricia Naheda Hamrick from the Pan American Health Organization's Health Emergencies Department will present the work of their team in developing compelling web GIS applications. Then Karar Youssef from the UN Habitat Iraq program will discuss how they are leveraging ArcGIS Hub to support the unique aspects of the COVID response in Iraq. We will conclude the session by sharing resources that you can readily use following this webinar. And then we will have the question and answer session. GIS is a complete system for understanding and responding to pandemics. And empowers collaborative action, all supported by you, the GIS professionals. From surveillance to logistics, planning to community engagement, GIS plays an important role. Now I'd like to ask Calvin to share with you how mapping supports COVID-19 response and recovery. Calvin.
Thank you, Carmel. So without a doubt, everyone on this webinar is probably familiar with the COVID-19 dashboard that you see on the screen today. As of this week, the mobile and desktop version of the dashboard has been viewed over 2.2 billion times. And while the high view count is reflective of the devastating reach of the pandemic, the popularity of this dashboard and thousands of others like it is waking up the world to the need and the importance of spatial understanding. So questions like, where's the disease spreading? Where are the vulnerable population? What is the impact of social distancing policies on the disease spread? And where do I need to deploy additional medical resources? Are all fundamentally spatial questions that require spatial thinking. And with this growing awareness at the global level, your role and the role of the GIS professional has never been so important. And we're seeing our users leverage ArcGIS platform as an integrated and iterative system for managing COVID-19 response, whether it is to understand community risk, measure effectiveness of social distancing policies, managing resources, or communicating this information with the public. And while today's webinar will focus primarily on workflows using ArcGIS Pro, the work to support COVID-19 responses enabled by the COVID-19 information model and the full breadth of the platform. So desktop, apps, web apps, and even developer technologies, some examples of which our user presenters will share after my demo. So before we dive into the demo, I would like to start by very briefly introducing you to ArcGIS Pro. ArcGIS Pro is Esri's next generation desktop GIS and is an integral part of our geospatial platform. It is used to manage data, perform advanced spatial analysis, and publish content to ArcGIS Online or ArcGIS Enterprise. And while ArcMap is still relevant for many use cases, most, if not all, of the capabilities I will share with you today are only available in ArcGIS Pro. So what makes ArcGIS Pro the modern desktop GIS? I've highlighted some of the key features on the screen, but it's really about increasing your productivity by making it perform better, making it easier to use, and giving you additional tools at your disposal. So today we're going to highlight a few of the new analytical capabilities available in ArcGIS Pro, specifically in response to COVID-19, and this is only available in ArcGIS Pro. So with that, let's jump right in and explore how we can respond to COVID-19 using ArcGIS Pro. So we'll focus on 4 workflows. First, starting with understanding your community, assessing risk, forecasting spread of the disease, and concluding the demo with allocating resources. So our first scenario will be about understanding your community using Hong Kong as the scenario. And Hong Kong, like many regions around the world, is combating the rapid spread of the coronavirus. To mount an effective response to the virus, let's begin by developing an understanding of the community by bringing different layers to get us to understand the context of that community. So first, we'll need to bring in a few relevant layers. And to do that, we'll connect to the Living Atlas to pull a polygon layer of all the districts in Hong Kong. And Esri is providing a Living Atlas as a way for our users to gain access to authoritative data sources. So while the data is curated and managed by Esri, most of the data comes actually from our community members who are authoritative repository for this data. So we brought in the layer, and we see that when we open up the layer, the attribute within that layer is pretty minimal. It has only information about the population. So we're going to go ahead and geo-enrich the boundary layer with additional attributes to better understand vulnerable populations in the community. And geo-enrichment is a method unique to GIS. It provides the ability to get facts about a location or area. So we use the data layers from ArcGIS Online, but you could also do this using data layers installed locally on your device if you're using Business Analyst. And to access the enrichment tool, you go to Analysis, click on the Gallery dropdown, and click Enrich. And the tool is quite simple. All you need to provide is the input feature, which will be the boundary layer that we have here. And the next step is to click on this plus button to go to the Data Exploratory menu. And this gives you data in ArcGIS Online that you have access to, which you can now enrich the original layers with. So I'm going to add population and the population density, which are 2 attributes that are important to understand communities at risk for COVID-19. I've added these 2 layers, but rather than going through each of them, I'm just going to open up a tool that I ran previously to show you what parameters I've added. So we have the population density. We also have information on the tobacco spending and purchasing power, which are indicators of risk group in the community. We've also added information on the population of age 60 and over, which are high risk group for COVID-19. So using this, I'm going to just change the name here and run the tool. And what this tool is doing is basically taking the attribute from these layers and joining it to the original district layers that we provided. That we've added a new layer, and we could confirm that these new attributes have been added to the original layer. For additional context, we're also going to add data layer pertaining to recently confirmed cases of COVID-19 by searching ArcGIS Online. And not only do users have access to the authoritative content in ArcGIS Online or in the Living Atlas, but users could also search for content that other users in the Esri ecosystem have shared to ArcGIS Online. So I've identified the layer using an item ID, which is a confirmed case of COVID-19 as of February 27. So now that we have the attributes associated with each district and confirmed case of COVID-19, the question is, like, how do we make this information more actionable? And for that, we can use the infographic capabilities in ArcGIS Pro. And you can access this tool by going to Map, click Infographic, and it'll give you this clicking cursor. And if you click on a boundary layer, it populates the infographic panel with a basic information. And there's a bunch of templates that Esri provides, but if you have access to Business Analyst Online, you're also able to configure your own template out of the box. So I'm going to use this template that I've configured to bring out the infographic specifically tailored for COVID-19 response in Hong Kong. And you see that the infographic has been populated, it's totally dynamic, and I even have access to map elements as well as access to even the pop-up elements within the map. So what's more, so this report could also be exported as dynamic HTML and even have the interactive experience enabled. So once you export this, you could share this report with anyone that needs to have access to this information. This includes executives or partners who may not have access to ArcGIS Pro or ArcGIS Online. So that report looks something like this. This is an export of a report that's locally in my device. And you see that interactivity is preserved, and the pop-up element also is interactive. What's more, you could take this service, publish out online to ArcGIS Online to create a report that looks like this. And this is a report generator that our team at Esri created. And basically, you get to click on the region, click on the open report, and you could get the latest infographic information based on the latest confirmed and death cases of COVID-19, as well as other relevant attribute information to understand that community. So now that we have a good understanding of the community, let's move on and assess the risk and plan an appropriate response. And we're going to continue with our example with Hong Kong. And we'll create risk maps for transmission, susceptibility, and resource scarcity. And a few months ago, along with the COVID response, Esri released a white paper that contained some information on type of risk that a community should consider when assessing risk. And this includes transmission risk, susceptibility risk, resource risk, exposure risk, and socioeconomic risk. And we also outlined some of the sort of GIS layers that you should consider when calculating this risk profiles. And of course, this isn't like a comprehensive list, but it's a list to get you started to think along the right lines. So we're going to take these layers and these attributes and calculate these four risk profiles for Hong Kong. But before we do that, let's first talk about the layers that we have and how we're going to use them in the analysis. As you recall, we have the constituency data, the district's data layer, and we've added from the previous step, the population density, and so on. But I've also added, for this purpose of this analysis, a few additional attribute parameters. This includes healthcare resource index, which speaks to the number of hospital beds in the region relative to the total population. The spatial interaction index, which was computed using the network connectivity, so the connectivity of the roads within each region, and relative case distance index, which is the distance in meters from the centroid, the center of the district, to the nearest 10% of the confirmed COVID-19 cases. You also see that we have this layer called target risk. And target risk had the same data schema, the same attribute information. But what's different about this layer is that each of the the single record that we have represents the worst case scenario when it comes to COVID-19 infection. So district that represents the largest number of population is listed here, the highest number of senior population, the highest spending for tobacco, the lowest level of healthcare resource, and so on. So these worst case values will be used as a target against which all other constituencies will be ranked in order to determine the risk. I've also brought in a simulated case of COVID-19 to Hong Kong for additional context. So we'll first begin by mapping the transmission risk. And we do that by using a tool called similarity search. And here's the tool. And we're going to begin by bringing in the candidate feature. These are the features that we're going to rank using the target risk as a features to match. And I'm going to name this transmission risk. And we're going to compare the boundary layer against the target layer and find boundaries with most similar attributes using the following: the population density, as well as the spatial interaction index. Because for transmission to occur, there needs to be high level of population density and high connectivity. We're also going to append this using the ID and number of results to 0 to rank all the results, and click run. So when this tool runs, each constituency, each district is ranked from 1, so most like the worst case feature, to 431, which represents the total number of districts in Hong Kong. So 431 will represent the least like the worst case feature. Features with dark colors have values for population density and spatial interaction, most like those in the target risk layer. And you also note that the darker color areas correspond to higher risk for transmission, which mirrors the known cases of COVID-19. So we'll repeat this process for the other risk profiles. So for this, we have susceptibility risk, and we run this tool using the senior population, tobacco spending, and purchasing power index. For resource risk, we have the total number of senior population, as well as the healthcare resource index. And finally, for exposure risk, we're using the relative case distance index to calculate the risk profile. And once we do this, this is the result we get. Here's the transmission risk. Let me get rid of these layers so it's more clear. Transmission risk, susceptibility risk, resource risk, and exposure risk. So what we have to do in the next step, and what I've already done, is to take the ranking for each of this layer and join it to the original boundary layer. And I've also reversed the order of the rank so that the highest value of the rank, the highest number, represents the worst case scenario. So I've joined each of this risk profile to the boundary layer and reversed the order. So the lowest number represents the lowest risk, and the higher number represents the highest risk. So now that we have all the results in a single layer, we'll cluster the districts with similar characteristics based on the 4 types of risk using a tool called multivariate clustering. So I've already pre-populated the tool. We basically took this input feature, the district layer, named it risk profiles, and we're going to use the 4 risk profile that we just calculated, the ranking, to determine clustering of a similar district with similar risk profiles. And let me run the tool to show you what that looks like. So multivariate clustering tool creates groupings such that values within each group are as similar as possible, and the group themselves are as different as possible. So what you see here is that we have three groups, group 1, group 2, and group 3, all highlighted in different colors. And once you open one of the outputs, the box and whisker plot here, we could understand sort of the risk profile for the different regions. So what this result is showing is that regions in red, so the group number 2, have the highest risk profile for exposure, susceptibility, and transmission, and second highest for resource. So these locations, so these districts, should be the highest priority for minimizing interaction. So keeping children from school, limiting visits to senior communities, and canceling large events, and so on. On the other hand, the blue group, group number 1, has the lowest risk for exposure, but the highest risk for resource. So in addition to practicing social distancing, the groups in blue will benefit from additional hospital resources like hospital beds or quarantine centers. And lastly, the green group, group number 3, has lowest risk across the board. And this is expected because these regions represent areas of Hong Kong that are less populated. So we could change this to imagery, change this appearance to confirm that, yes, the green regions happen to be less populated centers of Hong Kong, which is why it has the lower risk profiles. So far we have used tools available in ArcGIS Pro to understand the community and assess this risk at the regional level. In the next example, let's explore how we might forecast the spread of COVID-19 cases using a SIR model called CHIME. So in this demo, we'll use a model developed by University of Pennsylvania's School of Medicine called COVID-19 Hospital Impact Model for Epidemics, or CHIME for short. And the model is widely used and is based on SIR population, so susceptible, infected, recovered, to forecast where there will be needs for beds, ICU beds, and ventilators. So this model was recently brought into ArcGIS Pro as a geoprocessing tool to help health agencies forecast the spread of COVID-19 and plan accordingly. So you could go to arcgis.com, search for ArcGIS Pro COVID-19, and you will have access to this tool that you could download for free and use within ArcGIS Pro. So this tool actually includes CHIME model, which we will review today, but also CDC's, so Center for Disease Control's SURGE model. And it's widely said like CHIME represents the worst case scenario, and CDC provides more optimistic, realistic scenario for forecasting COVID-19 spread. So with any model, the most important part about this model is data. And if we have the data, we could run more accurate forecasting models. And in this example, we have the state of Arizona by county, and we have information about the hospital network in each of the county. So I've clicked on a county here, and we have information about the number of beds, information about the percent of people who are hospitalized related to COVID-19, and so on. So while this example is based at the county level, this model could also be applied to a single hospital or a network of hospitals that doesn't necessarily follow the county boundaries. So let's open up the tool and take a look at what sort of input is required. So here's the tool, and you see that there are a bunch of parameters that needs to be inputted. I just want to go through one by one so we really understand how this tool works behind the scenes. So the first really important input that is needed is the population. And this population field represents the total susceptible population, the people who are susceptible of getting COVID-19. And in this case, this represents the population of the county. We also need to provide the information on people who are currently hospitalized for COVID-19. And the model is going to take this value and the hospitalization rate to estimate the total number of people carrying the virus in the community. So this is the I portion of the SIR model. We also have the number of days to project. UPenn Med recommends to keep this below 100, so we're going to keep it at 90. And we could set the start date for the model, and this will just give us the dateline when in the output that we have. There are also various model parameters there you could fill out. So you could either do it using constant model parameter, so using constant values for all the counties, or use field-based parameters to give dynamic different values for each of the counties here. And an interesting input that we see here is the social distancing percentage, which aims to capture the reduction in social contact based on policies like stay-home orders. There's a great amount of data emerging out of this crisis, and one way we're measuring this is to get movement data from mobile phones to calculate the effectiveness of social distancing measures. And we can use this data to understand where social distancing is and is not happening to give dynamic measures for this value to get a better model. An example of that is one of our partner data from Unicast, and this basically compares the movement of human movement data from a baseline before COVID-19 to calculate the average reduction of social movement or human movement and give a grade according based on that reduction. So we see many of the counties in the US are shown in red, grade F, as more states open up. But you can see how this value could be used within this tool to give dynamic measures of social distancing percentage. So we could also assign parameters like hospitalization rate, ICU rate, and ventilator rate. And we know that this would vary spatially because these values would change based on the underlying population. So for example, like state of Florida, which has population with higher age demographic, the older demographic, would have a hospitalization percentage and ICU percentage that is higher than the rest of the country. So now that we have this info and we understand what each of this represents, let's run the tool and look at the output. Take a moment here. So the map shows, the result of this analysis shows the number of people that will be hospitalized at the peak. So we have the peak hospitalized census at 6,500 for this county, meaning at the peak of hospitalization, there will be over 6,000 people who are hospitalized in the hospital. So taking the visualization a little bit further, we could visualize something like this. And we see that the central counties here are going to exceed the number of beds and going to have too many patients who are going to be hospitalized. So in this particular county, there are going to be over 5,500 new patients who won't have a bed or hospital bed because it's going to exceed the available capacity. The analysis also gives us these three charts as an output. So let's see what each of these charts show. And this chart shows first new daily admission projections. So how many people are going to be hospitalized on a given day. So for this model, shows that for the state of Arizona, there will be about 1,200 new hospitalization on day 46, which looks like the peak. There's also another chart that shows the daily hospitalized census, and this represents the total number of people who are hospitalized at any given point. And you see that this axis is much higher because people who are admitted to the hospital tends to stay a week or more, especially for COVID-19. So at the peak, there will be over 8,000 people who are hospitalized in Arizona. And we also have charts on the SIR population. So what's really interesting for this model is to run this model with different assumptions. So in this case, I run the CHIME model with 0% social distancing. So business as usual, where there is no social distancing measures in place. And let's see what the impact of that is on on the outcome of this model. And you'll notice that reducing the social contact reduces the peak. So we have the peak at 1200, whereas with no social distancing, we have a peak at 6000. And it actually pushes the peak later. The peak when there's no social distancing happens at day 34, 35, whereas the peak for scenario where there is social distancing happens in day 48, closer to 50. And this is critical because in a pandemic like COVID-19, reducing the peak and spreading out the infection over time helps to protect the healthcare system. And how we see our users using this Chime tool is that they run this tool every morning when they have new set of data from the field to understand how their policies are impacting the spread of the virus. So of course, this model is not perfect, but they're using this model and other models in conjunction to inform their decision making. So let's move on to our final demo, which we're going to use to understand how to allocate resources. And because the output of the Chime model is part of ArcGIS Pro, we can extend this analysis to understand how to distribute resources using a tool called Location Allocation. And in this fictional example, I brought in the hospital location in Arizona, shown in black. And I've labeled the hospitals in red as hospitals whose patient capacity is going to be exceeded by the number of available beds. So these red hospitals are going to have more patients than the number of beds available. And these blue hospitals are hospitals in the outskirts of Arizona, which has spare bed capacity. And to perform this analysis, we're going to turn on a location allocation layer. And this layer asks us to import two types of facilities, one as a demand point and one called facilities. So demand points will represent the hospitals in red, which has excess number of patients that require beds. And the facilities will be represented by the blue hospitals, which has spare capacity. We're going to use a solver called Maximize Capacitive Coverage to allocate the patients from red hospital to the blue hospital without exceeding the number of beds that the blue hospital has. And that's represented by the demand allocated field here. So this hospital could take up to 10 additional patients. And we're going to ask the tool to find 24 facilities, which represents the 24 blue hospitals shown in this map. So once I run this tool, this is the result I get. If I do some post-processing visualization changes, we could get a visualization that looks like this. And what this is showing is the thickness of the line shows the number of patients that has been transported from the red hospital to the blue hospital. And the size of the blue hospital represents the spare capacity after the patients have been allocated. So we see that this blue hospital had 16 available beds, and 10 patients has been allocated from this red hospital, and 6 patients has been allocated from this red hospital. So now it has 0 spare capacity. So we see that at the statewide level, and you could imagine running this tool as new data emerges from each of the hospitals to understand where the patient needs to be allocated to improve hospital or patient outcome. And while this example showed how to allocate patients to hospitals with spare capacity, we also see users use this tool to understand where to locate testing sites as states and regions open up. So where can you place the testing sites for COVID-19 to maximize the coverage of the vulnerable population? So there are multiple use cases for this tool, and I hope you start to explore this tool if this is a workflow that you think you need. So to summarize, we just forecasted the hospitalization rate using CHIME and extended this analysis with location allocation in ArcGIS Pro. And ultimately, this is about improving efficiency and improving quality of care and outcome at the state level. So just now we explored the workflows to understand the community, assess risk, forecast disease spread, and determine how to distribute resources through location allocation. But as I shared in the beginning, users are maximizing their impact by leveraging the entire ArcGIS platform. The examples of leveraging this will be shared by our esteemed presenters from PAHO and the UN. And now I'll hand it over to Cornell. Thank you.
Thank you, Calvin. Now we will be inviting our community presenters to share their work, as Calvin noted. First, we'll hear from Patricia. She's a GIS analyst with the Health Emergency Information and Risk Assessment unit within PAHO's Health Emergencies Department. And then we'll hear from Karar, who's a data management expert with the UN Habitat Iraq program, and he'll be sharing his work there. So Patricia, I'll make you a presenter, and please go ahead.
Thank you. Are you seeing my screen? No.
We are currently seeing your desktop, so not the presentation.
So I need to find my, maybe I should do this. Do you see the presentation here?
Yeah, yes, we do. If you could make it full screen, that'd be great.
Yeah, I'll try. Okay. I'm sorry, the technology sometimes here.
You certainly know you've been very busy these last months.
Okay.
At the top, if you could just go to display settings and then switch, swap. Yep, you'll be all set. Thanks.
Okay, thank you.
Perfect.
Excellent. Okay, then I'm going to present the GeoHub COVID-19 for the Americas region. This is part of it was developed and it's being developed still by the PAHO Health Emergencies Department under the coordination of Dr. Enrique Perez. And I'm presenting here the team that includes G, Reda, Claudia, Pravjot, Ravi, and the Esri support team. Basically, I'm going to present in the context of the PAHO response that has critical pillars in which is based to prepare the cooperation strategies and actions with the countries. I'm gonna try to make a demonstrations of the GeoHub, showing some of the interactive dashboards and the distribution of the infected population and time and space. Here, these are the basic, the critical pillars that the PAHO response, in which the PAHO response is organized. It's three of them, basic three of them, that is save lives, protect healthcare workers, and slow the infection spread. And what we are doing here is we are in the bottom of these pillars trying to generate evidence for action. And how do we do that? We are trying to collect and compile information from countries in different levels and trying to display it using maps and using some spatial analysis and also other kind of epidemiological analysis. Our main objectives are here is to produce evidence for action. We want to integrate an integrated geospatial data and analytics tool to support all the dynamic of the COVID response. We need to promote the international coordination and situational awareness. And also we are trying to provide near real-time information to countries to reinforce the surveillance systems. This is the workflow of this geographic information system. It has several components. All are centered in an ArcGIS Online clouds with all the layers, hubs, the dashboards, maps are concentrated there. We have our services in Apache server, and from there we're interchanging information to several points. We are sharing information with WHO and with the countries that belong to the Americas region. And it's interesting, this system, because we are trying to invite the countries to enter their own information daily by admin 0, by country, and by admin 1. And 30 minutes after they enter their information, we have a program scheduler that creates and refreshes the information. So if they enter the information at 9 a.m. and 9:30, a little bit later, they are going to have their situation updated. The system is using this platform. Is a data entry platform system that was translated into 4 languages: English, Spanish, Portuguese, and French. Because of the diversity of our region, we have 58 countries and territories that have different cultural backgrounds. And I'm showing here the entry data for Argentina. And now I'm going to show the components of the hub. It has several dashboards or panels that some of them are include maps, some of them are just charts or some analytical charts. In the main one, you can see the curves. We have here the cumulative cases. Sorry, this is a sorry, this is a PowerPoint. I was going to be interactive. It has connections to subregions, and we can display the curves of cases, new cases, cumulative cases, deaths, new deaths, and recovered by subregion and country, and with the totals on the top of each of them. The second panel is an interactive dashboard with the totals, the list of countries ordered by number of cases, the cumulative incidence rate by admin 1, and that was calculated with a global population database. Then we have the curves by the countries, and the curves are interactive too. And in the lower right, we have a series of charts showing the countries with highest rates, with higher number of cases and higher number of deaths. This is a table that shows the totals in a cutoff time of 3 p.m. every day. This is the table we share with WHO. And with this total of cases, WHO creates their reports too. This is another type of information that we work with other technology. So we insert other visualization reports into the hub, just using the URL of them, and they become interactive. Here we are seeing the doubling time of COVID-19 cases in the America in 2 types of scales: normal scale and logarithmic scales. And it shows how frequently the countries are doubling the number of cases. And this is other indicator that there is the effective reproductive number that shows the level of transmissibility, and it calculates the average number of secondary cases caused by an uninfected individual. And at the end of this main regional hub, we have this visualization of a 3D scene of cumulative cases that is that it has a live connection. Now I'm going to show them. I'm going to try to make a live presentation of them, of the hub. This is the connection to the old hub. We used to have a well, we still have it online, but we are going to introduce as soon as possible once we finish the connections. This is the live connection. Here we have the main indicators: 54 countries, 2.5 million infected people, 143,000 deaths, and a case fatality rate of 5.86. And we can share by, we can select by subregions. Here are the new cases, 7-day cases. And for example, I'm gonna select Central America, and it displays the number of new cases the last 7 days that are happening in this area of the world, in this area of the Americas. In this other dashboard, we have the complete region of the Americas with the cumulative incidence rate by admin 1, and it has the interactivity showing and zooming to the country with the curves, displaying the curves. I would like to show you Nicaragua. It's very interesting because Nicaragua is not reporting yet by admin 1, but we see here that Alajuela and Heredia have a high number of cases. So knowing that there are neighbors that have higher number of cases can help the country to improve their surveillance system. Here we have, this is like a template that we reproduce for the subregions and for each of the countries. Here we have by case, order by cases and by number of deaths. This is the table I was telling you. Is this everything is interactive here? Some epidemiological trends with connection to other data sources like FluNet. We have everything here in connecting different data sources, not only the one that we're using with the data entry platform. Here's the doubling of the charts with the doubling of cases, the evolution of the effective reproductive number. I'm gonna go for Argentina and display, went back to, this is Argentina. And this is the display of the cumulative cases. This is up to yesterday at midnight with the data. Is almost near real-time information. I forgot to show something. I'm so sorry. This is very important. This is how we organize the hub. We have a regional hub with all the dashboards. We have four sub-regional hubs, one for North America, one for Central America, one for South America, and one for the Caribbean. In total, we're aiming to produce 54 country hubs, but some countries or territories don't have administrative one data. And now we are in the testing periods, trying to receive information live from Argentina, Chile, Venezuela, and Costa Rica. We have been talking with other countries like Guyana and Suriname and Belize, and they may join the effort of trying this part. Okay.
Thank you. Thank you so much, Patricia. You've covered what's happening in the entire hemisphere, so that's fantastic to see all the work that's been done. So thank you so much.
You're welcome.
Yeah. Karar, I'm going to make you the presenter now. And if you'd like to share your work, thank you.
Thank you. Thank you, Carmel, and welcome everyone to my presentation. First, I will go through an introduction of our UN Habitat program in Iraq, and then I would briefly introduce you to our using of GIS or ArcGIS software. Also, I will go through our response of COVID-19 in Iraq. Actually, UN Habitat has been active in Iraq since 1996. You can see here the major milestone of our response. As you know, in Iraq War in 2003, UN Habitat was largely engaged in early recovery efforts, particularly those supporting internally displaced persons, the IDPs, through provision of shelter and reconstruction solutions. In 2014, after the conflict caused by ISIL, UN Habitat expanded beyond emergency response to include humanitarian programs such as providing IDPs and returnees with dignified shelter and living environment, and include development programs like provide technical and capacity development support to the national and local government. Here are some key achievements of our program. As you see, there are more than 3,000 war damaged houses were rehabilitated in the period between 2016 to 2019. Also, more than 4,000 durable shelter units were constructed to accommodate the vulnerable IDPs and returnees. Also, we can contribute with the government to develop the national urban strategy and the national housing policy. Also upgrading the informal settlements to support decentralization. Also, we support the government of Iraq to monitor the recovery efforts through developing the national platform for construction and development. Also, we support housing and land property rights of returnees and displaced persons. It's good to know that Iraq, the total population of Iraq is now more than 39 million people. More than 1 million people are currently displaced. Also, as the last survey conducted by Ministry of Planning, there are more than 3 million people are living in informal settlements. UN Habitat is consider mapping and GIS as a major duty to support the recovery activities in Iraq. After 2014 and the conflict caused by ISIL, mapping had a major role in preparing Mosul city profile, which includes a comprehensive mapping assessment of the city's infrastructure, housing, social services, and demographics to help planning humanitarian and development assistance. These assessments, we assess the damage caused by ISIL and also the multi-sector assessment. And all these could be found on Mosul portal, which is based on ArcGIS online project. Here at the right of the screen, you can find the debris dashboard, which has been selected for publication Esri map book volume 34. After liberation from ISIL, we support the government to develop the National Recovery, Reconstruction and Resilience Platform, what we called RR platform. This solution based on using ArcGIS Enterprise to support government and UN agencies and all international community to monitor and manage the recovery efforts. Also, we help government and shelter cluster to develop the housing rehabilitation portal, which focus on the housing assessment and the rehabilitation activities. COVID-19 in Iraq, the first case was reported on the last week of February. UN Habitat responded early in March to bring GIS to help the government and UN agencies and all the stakeholders to monitor the COVID-19 cases in Iraq, and we work with WHO and the Ministry of Health to develop some dashboards to monitor the cases and give some analysis about the pandemic. But we are what we are focusing on in UN Habitat is the vulnerable communities in informal settlements and the conflict-affected areas. As you know, in Iraq, there are more than 3 million people are living in informal settlements, and also more than 1 million are still displaced, according to IOM DTM matrix. So, for example, we brings all together the informal settlements, the poor areas, and the main affected areas. As you see here on the screen, we took the Baghdad as example. As you see, Baghdad has more than 8 million population, with more than 800 informal settlement dwellers. Also, till today, there are 2,348 reported cases. So as you see on the right side of the screen, the most cases is reported from this side, with what we call the Ressafa. As you see, the informal settlements area in the yellow color, this is all the informal settlements area in Baghdad. And the blue formal areas affected by COVID-19. This is the blue polygons. So the informal settlements area affected with the brown color. So we bring all these layers together to highlight the high risk hotspot of COVID-19. To find a correlation between poverty, informal settlements area, and COVID-19, and highlight this to governments and local governorates and other governorates as well. In April, we launched our hub sites to communicate all these issues together using Esri hub site. We launched this hub site in April in both language, and Arabic and also English. It linked the user to the key messages of UN Habitat on COVID-19 and also on COVID-19 and informal settlements, and also on COVID-19 and housing. Also to provide an updated information to COVID-19 cases by governorates. Also, there is a link to the WHO dynamic dashboard that provide complete analysis of the cases. Also, we present the cases by governorate. As you see here, Baghdad has the most affected ratio. Also, we are highlighting the main issue of poverty and informal settlements to focus by government to these issues. So as you see, there are 3 million informal settlement dwellers and more than 500 informal settlement units. As you see, this map, it's overlaid the 2 layers of IDPs, which is in blue points. Also the informal settlements areas. As you see, it's centralized in the middle of Iraq and the south. So this is the hotspots of poverty and the areas that needed a response. Also, there is a key message from UN Habitat management, and also highlight our response to this pandemic through waste management activities and livelihood and public messaging. Also, we highlight the impact of COVID-19 on SDGs in this diagram from UNDSA. Also, there is a video for social distancing and useful link to monitor or to link the user to useful links like WHO safe practices and the key messages from UN agencies and extra. So this is our response, and we are now working to highlight the high risk posts in two governorates, Baghdad and Basra, which has the main affected cases. Basra and Baghdad has most affected cases, and also has a lot of informal settlements and poor area. Back to you, Kamal. Thank you.
Thank you so much, Karar. Great work. It's really interesting to see the work that you're doing between you and Patricia at the regional level and then at the very local level. So thank you so much. I want to thank Patricia and Karar. I'm sure that you will all agree with us that their applications show a lot of innovation and dedication to communicating information effectively and helping others make informed actions to respond to this pandemic. I'll conclude our agenda by sharing a few resources so that you can get started with your own COVID-19 related applications. Just for anyone that may need to head to another meeting or call, I just wanted to make sure you noted that there's a handout with a link to many of these resources in the handout box of your GoToWebinar control panel. So you may want to download that, and I'll mention it more in a moment. So I wanted to share a little bit about the Esri Disaster Response Program. When your capacity to respond to a crisis is maxed out, or you have additional GIS software needs, please note that Esri has a robust disaster response program in place. We are here to help 24/7 with resources located around the globe with our distributors and via a dedicated team at Esri to support you during times of natural disasters, humanitarian crises, or in this case, a health emergency such as this pandemic. We can assist with provision of ArcGIS software, workflow implementation, geospatial data, and/or technical support. Esri's DRP has been fully activated since the beginning of this pandemic and remains a resource for you. The Esri COVID-19 GIS Hub is found at go.esri.com/coronavirus. It has data, applications, and many resources to support you. So I encourage you to spend some time exploring the applications like this index of global COVID apps, which includes great examples indexed by country. The Esri user community has come together to support one another on the GeoNet site, where additional resources are noted. Please join in the discussions about how to best use ArcGIS to make meaningful impacts in the face of unexpected challenges as this pandemic and our understanding of COVID-19 expands. ArcGIS Solutions for Coronavirus is a new set of solutions that Esri has developed. We've developed a number starting with our response solution. In addition, though, we have solutions to support continuity of operations, location of testing sites, applications of hospitalizations and PPE resources, status of hospitalizations and PPE resources, and more. We have also have resources such as the hub template for coronavirus and other tools such as models for forecasting hospital peak capacity, as demonstrated by Calvin earlier. Let's take a closer look at the Corona Response solution. The Corona Response solution includes a series of maps and apps to be used by public health agencies as they work to support their communities. Several thousand apps have been developed using solutions such as these at this time. If you have never explored ArcGIS solutions, it's time to do so. And you will find this at solutions.arcgis.com. The one resource that many of you perhaps have seen is the Coronavirus Response Hub template that people have customized. We have had people configuring this Hub template, and anybody with an ArcGIS Online account can launch this for free. One of these hub sites that you might want to explore is the UN OCHA Somalia Hub that is really well done and in support of response planning for a fragile state. You'll notice that there's multiple languages, multiple configurations of this, but it provides you a template and to start being able to do this very rapidly and launch your own hub site. We also have a couple of announcements. We have partnered with a few international organizations in responding to this pandemic. And on April 1st, Esri announced our support for the WHO member states, the Ministries of Health, and the Global Outbreak Alert and Response Network, or GORN. The GORN partners and the Ministries of Health can have access to the COVID-19 response package noted here. Since then, we've made other announcements with the Inter-American Development Bank and others, and have initiatives to support nonprofits, women in GIS, and to provide GIS training resources to furloughed workers, to provide opportunities to those individuals who might want to change careers and join the geospatial industry. Speaking of training, one last set of resources for you to consider are those available on the Esri Academy. Please search on COVID or coronavirus, and you'll find that 36 courses are now available. There's many. We've also developed a COVID-19 training resource guide and learning plans. You'll find those as well under that search. And we also have a number of Learn lessons at learn.arcgis.com. Anyone can freely access the ArcGIS Pro and COVID-related ArcGIS Learn lessons at this website. We hope that you will extend yourself to use ArcGIS Insights or some of the spatial analysis capabilities of ArcGIS Pro that Calvin demonstrated earlier, and there are learning resources available to you at this website. As I mentioned earlier, there's a handout with a number of those links. We went through them pretty quickly, and to make sure that you have access to all of those links, please do download the PDF file that is available to you in your handouts box in the GoToWebinar control panel. You can download a copy of that and share it with your colleagues. I understand from my colleagues that we've answered the questions that have come up in the Q&A, but I would like to ask if anybody else has any other questions, please just drop a note into the question box of your panel, and we will answer those if you have any further questions. I'll go ahead with the summary since we're a little over time, and then if there are any other questions, we'll be sure to answer those before we sign off for the day. So this concludes our webinar on GIS and COVID-19, how mapping supports the response and recovery. My sincere thanks to Patricia, Carrar, and Calvin for sharing their expertise, and I hope that you will share the recording of this webinar with your colleagues as we all work to overcome this pandemic. We hope that you will have these three key takeaways from our session today. Understanding how to use ArcGIS Pro in the context of COVID-19 response. Learn from examples of your peers and international organizations who are directly engaged in the response and recovery process. And understand where to find data sets and resources that might support your response and recovery efforts for your organization. Please consider the new and innovative approaches to using the ArcGIS platform and related resources during this crisis and in the response phases that lie ahead. Your work certainly matters. We hope that you enjoy the rest of your day from wherever you are joining us, and be safe and know that we are here for you. Thank you.